Hi, I've completed the Leadership Skills Questionnaire. We'll reflect on the findings. We're also going to consider the leadership and nurse manager functions and the organizational structure by using the model of care, which I have experienced in my practice. We'll also talk about how to secure needed resources for staff, such as staff. And we'll talk about published literature that could help in this process. So first and foremost, based off the questionnaire, I was stronger in interpersonal skills, which I could have told you that before even doing this questionnaire, and was moderate to, I guess, what you considered weak in this questionnaire in conceptual and administrative skills, which should probably also describe where I'm at in my experience in healthcare. As a new nurse, it's hard to necessarily be very, very strong in these areas, and I speak that from only my personal experience. Our healthcare model and our delivery model is changing dramatically, especially with the healthcare reform that's occurring. But our hospital supports elevating the role of the nurse and transition with caregivers to care integrators, meaning that the RN is the role integrating care for the patient. So taking the team approach, which we will talk about, we're also bridging the continuum of care, defining home as a different place, such as just like the setting of care. But we're also at our hospital, we're targeting our focus on the patient, our mission, vision, values at Novant Health supports delivering remarkable care in every dimension, every time. So saying that, it's also improving the satisfaction, quality of care, and while taking into account the cost. So our model of healthcare and taking care of patients is also changing, not only the delivery model, but the practice model. Currently in neuro ICU, we have no CNA, so it's the nurse. Then above us would be our team leader, and then above them is our clinical unit leader, and then, which we call the CUL. And from there, we'll transition to our manager, and above them is the vice president. Above them is our executive director is above them, and then it's the CEO. So of course we kind of work at times horizontal, it seems, but it's a vertical fashion. So if nursing staff, if there's an issue, we would go to the team lead would then go to the manager would then go to our department managers or VP, and then the administrators, executives, directors, so on and so forth. And how currently, based off of our management, I see the trend of if we need resources, need staff, need anything, the unit as a whole has to express that concern. The one nurse really doesn't get a lot of notice, so going up through the right chain of command would help with resource. As in Chapter 7 by Gohar and Langan, they identified different skills that would help in securing these much needed resources, such as like planning and organizing. This would go to my benefit because I could use my personal skills, which I scored higher in on the questionnaire, to utilize resources. So I have the capability of being able to read people. I can tell you when a situation is going wrong, how people, just by their body language, how they're feeling about a situation. So this would be the first step in letting others know what resources we would need. Viewing staff, because right now I feel as I'm a group of the staff, and I hate to feel like there's a differentiation between the managers on one level and the staff is on another. But a staff as a whole, if you can at least get a little bit of a census of how satisfaction is in the workplace, that also allows, if you're needing staff, to maybe fix those things that are going wrong on the unit so that you can keep staff. And that's a major thing, especially in critical care, emergency areas, deal with all the time with the shortage. So as a manager, I would assess staff morale, utilize minimal resources while having a better outcome, and also communicating. Communication is a key factor at all levels of management, staff, or authoritative position. So I would also use an evidence-based practice to help allocate funds, resources, or staff members. According to my article, interdisciplinary care it seeks to obtain the best outcome for the patient with a greater integration of healthcare professionals within the team. This is one thing that my hospital does great with. We even have interdisciplinary rounds every day at 11 o'clock where we have physical therapy, occupational therapy, our doctors, our nurses, all these people attend to seek out the greater good and for our patients. So this is a resource and supported by this article why our health care would benefit by using this type of system. I prefer a horizontal type of model of care, but unfortunately I'm in right now vertical, just because why I prefer that. At a vertical level, sometimes it's hard to get concerns and problems at a lower level heard. When it's more horizontal, there's more of an understanding. You don't have to jump through leaps and bounds to get at least noticed. Also, working with different levels and departments. Currently, our floor, we work with all departments. So from ICU, you go to either neuro floors or medical units or intermediate critical care units. All these are areas that you'd have to work with and be proficient with to help with management and managing resources. I'll attach the article with interdisciplinary rounds along with this. Thank you.